Today I will be talking about how to clean a site for Pezzer G tubes and J tubes. This type of tube is placed in surgery. The site is the skin around where the tube is placed. I will tell you how to care for the tube and site. First, I would like to go over what to expect when the tube is placed. The site will be tender for up to 2 weeks. The first couple days after the tube is put in are when it is most tender. Expect drainage at the site, especially some bloody drainage for the first few days after the tube is put in. This is normal while the tract is healing. The tract is the hole where the tube is placed. Gauze at the site is best when there is drainage to help soak it up. This will stop the drainage from drying up on the skin, which may irritate the skin. 1 split gauze is all that should be needed if there is drainage. Once the drainage stops, then it is best to leave the site open to air. Site care should be done every day. Start this the day after surgery. After 1 week, it is okay for your child to take a bath. However, no swimming for 1 month. Your doctor or nurse will let you know when to give your child's feedings and how much to give. Please watch our Feeding Through a G-Tube video on how to do this. Now I will show you how to take care of the Pezzer type of tube. This is put in during surgery. It looks like this. It has a mushroom on the inside against the stomach to stop the tube from falling out. Your child will have this tube in for at least 6 weeks unless your child's doctor tells you different. To do site cares, you will need soap and water, washcloth or Q-tips, tape, and split gauze if needed. The other important thing to help keep the tract healthy is to stabilize or secure the tube. With the Pezzer tube, it is stabilized with a bolster dressing. This helps stop the tube from wiggling and allow the tract to heal. It is best to make a bolster dressing before you clean the site. You will need the following supplies for the bolster dressing: 2 pieces of 3x3 gauze, 6 strips of 1/2-inch tape about 4 inches long. Here's how you make the bolster. Wash your hands with soap and water. Fold the 2 pieces of gauze in thirds the long way. Roll it tightly and put tape around it so it won't unroll. You can make several of them up ahead of time if you wish. If you do make several bolster dressings at once, store them in a clean Ziploc bag. Now let's clean the site. The site should be cleaned every day with soap and water. You can use Q-tips, a washcloth, or gauze to clean the site. First, clean with soapy water. Then rinse the site with water. Dry the site very well. If the site is left wet, this can create moisture, which can lead to problems. You can clean the site just as I showed you, or you could clean the site while your child is in the bathtub or shower. If there is a lot of dried, crusty drainage at the site, soak it off with warm water. It is also important to spin the tube in the tract each day with site cares. This stops the skin from sticking to the tube. Begin this the day after surgery, unless there are stitches. Then wait to spin the tube until after the stitches are gone. If the bolster dressing needs to be changed, here is how to do this. Remove the old bolster dressing. It is best to hold the tube while removing the old bolster dressing. Put the bolster on the skin next to the tube. Be sure to hold the tube straight up. If the stitches have been taken out, check the tube placement. Do this by pulling gently so the mushroom is snug against the stomach wall inside your child. This is only done after the stitches are taken out. Stitches are usually removed 5 days after the tube is placed. It is also important to twist the tube so the skin does not stick to the tube. Have the tube lay over the bolster. The tube should exit the skin and lay over the bolster dressing so it is at a 90-degree angle, so the tube is straight up. Put 3 pieces of tape over the tube and bolster dressing. It is best to lay the pieces of tape next to each other in the same direction. This keeps the tube more secure. Do not crisscross the tape. This does not secure the tube as well. Place a tension loop to secure the tube and dressing. This will help protect the site if the tube is accidentally pulled on. Take a piece of tape and fold it around the tube until the tape meets. Pinch the tape together where it meets. Then put the ends of the tape onto the skin. Some things to keep in mind when using a bolster dressing are The bolster dressing does not need to be changed every day. Change it only if it is dirty or not securing the tube. However, you should still clean the site every day. If the bolster dressing has been in the same spot for 3 days without needing it to be changed, then go ahead and change it. When changing the bolster dressing, it is best to move the bolster dressing to another area on this site. This keeps the tube from leaning the same way each time, which could make the hole larger. This also protects the skin around the tube. Other ways to stabilize the tube are to protect the site from being pulled on or bumped. Some simple ways are to put a one-piece clothing on that has snaps, such as a onesie. You could also try using an elastic wrap around the tummy and back, such as ace wrap, belly binder, or a large hairband, and then tuck in their clothing. Your child's tract will be healed after their tube has been in place for 6 weeks. The tube will be changed to a button type of tube. This is called a primary tube change. This usually takes place in surgery clinic, and they will let you know the date, time, and what to do before you come to this appointment. After the tube is changed for the first time, the nurses will teach you how to change it. Your child may need to have an X-ray type of test after the tube is changed to make sure the tube is in the right spot. This is where a little bit of dye is placed in your child's tube, and an X-ray will be able to see if the tube is in the stomach. After the first tube change, you will get a spare button type of tube sent to your home. The most important key things to remember helping the site heal are a clean site, a dry site, and a stable site. If there are any problems with the tube or the site that you are not able to take care of, call your child's doctor or nurse. The most common problems that can be taken care of at home are redness that is not spreading. Other common problems that happen when you may need to call are redness that does not go away or that starts to spread, leaking or increased drainage, granulation tissue. If the G-tube falls out before your child has had their very first tube change, the primary G-tube change, do not put anything in the tract. Cover the G-tube hole and call your child's doctor or nurse right away. If the tube falls out on the weekend or off hours, take your child to the emergency room. Thank you for watching.